Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. Topic of today is Tinea capitis. Tinea in general, first one should know that what is tinea. Tinea is a common fungal skin infection, also called ringworm tinea. It affects any part of the skin on the body from head to toe. Ringworm is not caused by a worm. This fungal infection forms a ring-shaped rash. Other similar rash can look like ringworm, like spider bites, nummular eczema, and Lyme disease. But these are not fungal infection as the tinea or ringworm. These are not serious, but these are just make the patient uncomfortable. Here one can see the typical tinea lesions, and here one can see the central clear area and the margins which are red as it is here, and it can be on any part of the body. So that is the tinea according to the body site which it involves, the name is given. So the tinea capitis today, it also called herpes tonsurens, ringworm of the hair, ringworm of the scalp, or scalp ringworm, and sometimes it is called tinea tonsurens in different literature. It is a cutaneous fungal infection, dermatophytosis of the scalp, present with pruritic scaling area of the hair loss. It involves the infection of the scalp hairs, eyebrows, eyelashes, and the intervening skin. Infection ranges from the mild with slight erythema, few patchy scaly areas, to severe inflammatory lesions involving folliculitis or chorion formation. Often secondary bacterial infection results in scarring and alopecia, that is loss of hair. It is common in the inner city population and in the African American people. Here one can see the typical lesion with skin having no hair, that is alopecia, and these are typically found on the scalp as one can see. So it is that reason it is called ringworm of the scalp. Here again one can see the different presentation of the tinea capitis on the different scalp, and here these are, one can see the patches, the grey patches, the other, and the name of this is given according to the shape of the lesions. Now, epidemiology. It is uncommon in adults, mostly seen in pre-pubertal children between the age of 6 and 10 years, occurs in 3 to 8% of the pediatric population. It is rare after the age of 16, and it is seen more in the boys than in the girls. There are 8 species of the dermatophytes which cause tinea capitis, and they vary geographically from area to area. Disease is endemic in many countries. The fungal species responsible also vary, and cases of the trichophyton tonsurens infection mostly in the Central America, US, and the Western Europe, and infection from the Microsporum ordinary species mainly in the South America, Southern and the Central Europe, Africa, and the Middle East. This shift of the fungus is due to the widespread use of the grasshoppulvin which is effective against Microsporum ordinii than Trichophyton tonsurans. So that is the reason of spreading this fungal species. Changes in the immigration pattern and increases in the international travel is also responsible for spreading this infection to the different country. Another fungal species is Trichophyton violacum in the United Kingdom and in Europe. It is very much found. As spread occur through the direct contact with affected individuals, large outbreaks in school and children places have been noticed. 30% of the people in contact with an infected person are the carriers and they can spread the infection to the other. Now, the certain risk factors are if the person have got minor skin or scalp injury, do not bath or wash the hair often, the wet skin for a long time from the sweating also is a risk factor. Age, most common in the toddlers and the school-age children. Exposure to the other children. Outbreaks common in schools and the child care centers due to the close contact, as I have already mentioned. Then exposure to the pets, cats or the dogs having the infection without showing any sign, but they are the carrier and can spread the infection to the toddlers and the children. Children can get the infection by touching these animals. Now, what are the causes of Tinea capitis? Dermatophytes of the genera Trichophyton and Microsporum that invade the hair shaft. Trichophyton tonsurans is responsible for 90% infection and Microsporum canis is responsible for 10% infection. Other responsible are Trichophyton violacum that causes black dot Tinea capitis and Trichophyton schonleinii are also the causes of Tinea capitis. Here one can see Trichophyton tonsurans, the Trichophyton violacum and Microsporum canis and Trichophyton schonleinii. Transmission of the disease is number one, human to human, direct skin to skin contact, infected person to non-infected person. Number two, spread and transmission is object to the human by the contact with the inanimate objects or the surfaces which are collectively called fomites. This includes items like clothing, towels, bedding, combs, and brushes. Number three, transmission is animal to human by touching an animal with ringworm while petting or grooming dogs or cats with the ringworm. Ringworm is common in kittens, puppies, cows, goats, pigs, and horses. All are mostly the domestic animals, and the kids play with these animals to get the infection. Then asymptomatic carrier, the last transmission, people do have the fungus but they do not have the symptom, but they are able to spread it to the other people. And here one can see the types of the transmission: direct contact from the person to person, human to human, then indirect contact by the fomites, the objects which come in contact with the infected person. Then there is third is animal to human. As I have told you, the pet animals, the kids play with those and can have that infection. If you want to be a strong person, learn how to fight alone. And if you will just go with the crowd, you will be lost somewhere. But if you will be moving alone, you can reach to the destination. What are the symptoms of tinea capitis? There is thin, fine, dry or the greasy scales, a single or the multiple patches of the hair loss, thickened, scaly and boggy swelling or the raised red rings, which is called ringworm. Findings resemble dandruff, seborrheic dermatitis, atopic dermatitis with little or no hair loss, that is called bald patches, alopecia, discrete, diffuse, severe or subtle. Inflammatory response is patulous, pustules or crusting is there. Significant inflammatory response, large, tender, boggy masses, draining sinuses are seen, but it does not indicate the bacterial infection. It is because of the fungal infection which is having the draining sinuses, and one of the variety of is Tinea capitis. Now, Tinea capitis, there are scaly patches on the scalp, there are black dots on the scalp, there is scarring of the scalp, and there is permanent hair loss. That is the features of Tinea capitis. Now, symptoms continuing, the highest incidence is in school boys. Ringworm may involve part or all of the scalp, may have pus-filled sores called chirions. I have already told you. Posterior occipital lymphadenopathy, long-standing inflammation can result in scar formation, low-grade fever of around 100 Fahrenheit to 101 Fahrenheit or 37.8 centigrade to 38.3 centigrade, or swollen lymph nodes in the neck, as I have already told you, the lymphadenopathy. Ringworm may cause permanent hair loss and lasting scar sometime. Hair invasion occurs in two patterns, ectothrix and endothrix. I am going to tell the detail of that. Now, different types of the Tinea capitis has been seen. There are three types mainly, which are based on causative fungus and the nature of the symptom. Number one is microsporosis, number two is trichophytosis, and number three is Favus. The first is microsporosis. Leon is a small red papule around a hair shaft that later becomes scaly. Then hairs break off 1 to 3 millimeter above the scalp. This disease is caused by Microsporum ordinii and by the Microsporum canis. Source of the fungus is sick cats and kittens. And Tinea capitis is also divided in two parts. One is non-inflammatory and another is inflammatory. The non-inflammatory includes the gray patch, black dot, and the diffuse scale type. And inflammatory contain diffuse pustular, chirion, and Favus. Now, continuing the microsporosis, it spread through person-to-person contact or by sharing contaminated brushes and combs. The second type is trichophytosis. It is caused by the Trichophyton tonsurans, Trichophyton rubrum, but Trichophyton violacum is common in Europe, Africa, and India. Fungus causes dry, non-inflammatory patches, angular in shape. When hairs break off at the opening of the follicle, black dot remains. So here one can see microsporosis, and that is Microsporum ordinii, and here is the Microsporum canis responsible for. Then there is the Trichophyton tonsurans causing this type of patches, and then Trichophyton violaceum is responsible for that. And here is the Trichophyton rubrum, also responsible for causing this all trichophytosis. The third type is Phoebus. It is also called Tinea favosa, caused by the Tinea schonleinii. It is endemic in Africa and Middle East. Acute inflammatory infection of the hair follicle with perifollicular erythema of the scalp. There are concave, cup-shaped, yellow crust called scatula around the follicles. Scatula are composed of the fungi, neutrophils, dried serum, and the epidermal cells. These are grouped in patches like a piece of honeycomb. Each is about the size of a split pea with a hair projecting in the center. These increase in size and become crusted over with unpleasant smell. So here one can see the different scatula, and here is the pattern of the Phoebus. The different type of the scatula is there, and here again one can see the different scatula and cup shape, and that is because of the Trichophyton schonleinii. And here it is endothrix. Here is the hair shaft, and the spores or arthrochoridia of the fungal are within the shaft of the hair. For that reason it is called endothrix. And here the fungal spores are around the shaft of the hair, and they are just surrounding and encircling the shaft of the hair. For that reason it is called ectothrix. Ecto outside, endo inside the shaft. Now, pathophysiology of Tinea capitis. Tinea capitis is dermatophytosis, or the ringworm of the scalp and the hair. Fungus attacks stratum corneum and invades the keratin, produces the enzyme keratinase, which enables the fungus to use the skin keratin as the source of nutrition. Infection spread keratinized wall of the hair follicle just above the hair root. Hyphae grow downward on non-living portion of the hair and produced dull gray circular patches of the alopecia, scaling and itching. There are three types of infection: ectothrix, endothrix, and Phoebus. So here one can see the arthrochoridia. These just attack the stratum corneum, it germinates and hyphae grow, and these hyphae just are able to enter the stratum corneum, and again the arthrochoridia again that start germinating and involving the stratum corneum of epidermis. Now the dermatophytes, as is shown, these invade the skin, hair and nail, and all which contain the keratin, and skin abrasion is there, so the dermatophytes enter the stratum corneum, and here they release the enzyme keratinase. This keratinase able to digest the keratin, and there is inflammatory reaction that can lead to the redness, swelling, heat and alopecia, and then there is the movement away from the site of the infection, and that is central healing with the classical ring lesion. So if the healing occurs, so the spores from the soil or the animal or the man, these are being supplied, and these are the dermatophytes which are capable of invading the skin. Now, pathophysiology continuing. Ectothrix. As the hair grows out of the follicle, hyphae of the fungal species produce chains of the fungal spores, arthrochoridia, as I have already shown you. They are forming the sheath around or external to the hair shaft, exospores. These infected hairs flourish and give a greenish yellow fluorescence under the Wood's lamp specification 365 nanometer, and this infection is caused by Microsporum canis, Microsporum gypsum, Trichophyton equinum, and Trichophyton verrucosum. The other variety is endothrix, that is caused by Tinea tonsillensis, that causes black dot, Tinea capitis. It produces spores within the hair shaft. The orthoconidia are restricted to the hair shaft. The cuticle of the hair remains intact, and it is caused by the Trichophyton tonsillensis, Trichophyton violaceum, which are anthropophilic from the man source. These hairs do not flourish, they are weakened and typically break off easily at the follicular opening, and they give negative wood light test. There is lack of fluorescence, but lack of fluorescence does not mean it is not microsporum. Subculture any strands of the hair that flourish to help identify the real causative agent. The number 3 is favus. I have given it already in the types of Tinea capitis. So here one can see the spores are invading the shaft, as one can see, and they are around the shaft also. So when they are invading the shaft like this, these are endothrix, and when they are invading the shaft outside, here as one can see these variety, so that is called ectothrix.